I primarily care for cancer patients. I'm a urologic surgeon and I do mostly cancer surgery through the Cancer Institute at St. Joe's. And I primarily deal with prostate cancer and renal and bladder malignancies. When patients are given the diagnosis of cancer, it's as if they've been kicked in the teeth and they're so overwhelmed with the diagnosis, but it's incredibly gratifying to me to be able to sit them down in the initial stages of things and explain things at their level to the point of what it is, how we're going to attack it, come up with a full plan so that by the time they leave that visit, they're feeling 1,000 times better, because in my opinion, information is power. And once they have the information, that probably is 75% of the battle. The other 25% is actually going through the surgery and the aftercare. So I'm not the youngest guy in the world, but you know what? After 28 years of being in this profession, it's still pretty incredibly exciting to me. I must admit, I am a surgeon, so people claim that surgeons like to cut. I only make little tiny openings, so it's not that I like to cut per se, but to practice my craft is incredibly holy to me. It still is every single time I do it. And it doesn't necessarily have to be a robotic, complex procedure. It can be something simple too. But that's the part of my craft and my skill that I like the best. And probably the second best is, seeing them post-operatively and being able to come into the room and say, we just got your pathology report back and you really are cured, C-U-R-E-D, cured. And it's just an overwhelmingly powerful thing to be able to say to people. The tears that flow and the responses that they get and the hugs that you get and the hugs you want to give them, it's overwhelming actually.